Представьте ситуацию. Вы получили результаты анализов или выписку после приема.
Think about that. You got a test results or scan results, a lot of figures. You Google it and you panic. You want to get a second opinion, but that costs a lot. It takes a lot of time. You just upload the documents in the app, and in a couple of minutes you see a proper interpretation, including the risks and recommendations, instead of a 1 week or 2 weeks of nervously waiting for the second opinion. Going from symptoms to the actions. Meshcheryakova, the Third Opinion Platform Director, is going to talk about just that, how to make healthcare personalized.
Добрый день.
Hello, my name is Anna Meshcheryakova, and today we're going to talk about AI and as it is applied to healthcare. I am the founder and the CEO of the Third Opinion AI platform, the developer of AI healthcare solutions. This year we mark our 9-year anniversary, and we have more than close to 100 employees. The big chunk of this team are doctors. Now, we went through developing siloed software models based on AI to building our own proprietary platform solution. Now users log in and get access to a mart of healthcare NNs. Also, there is an education a section where AI can help doctors to look through the cases and to form their own individual development track for their skills. The platform also offers the community section where doctors can communicate with each other, can discuss difficult cases, and to enter into a discussion, a debate with AI. We have appeared during the first wave of COVID as a public company, and we implemented a video analytics for wards and in hospitals. After that, we have registered a whole range of medical NNs to analyze tests and scans like mammography and computer scans of the chest and the head. Now the platform unites the vendors of medical NNs, more than 5,000 doctors from 70 regions of Russia and 8 countries. But seeing how NNs work can not only be done by doctors, but you can do it as well. The Third Opinion platform last year got an educational license. When you register, we detect doctors, and if you are a doctor who have a medical background, you have a full medical functionality. If not, you will have the basic functionality. The NNs, neural networks, basically are registered in the hospitals as full-time employees, and today, for example, there are special tariffs, special plans based on the obligatory medical insurance, the state insurance. Now you will be able to do radiology, and you will be able to get the interpretation of the radiological study results with AI. It helps to increase the trust. Now the AI is already in the hospitals, and it helps to understand the symptoms, to understand the history, and to do all the other things. Without AI, doctors spend around 50% of their time to look at the history, to write down the results of the visit and other non-medical actions, non-medical efforts. NNs not only give time, but also the second, the third, the 10th pair of eyes that help them. And even before the visit, the doctor can actually plan the treatment and create a draft for the future treatments. If there are no hospitals, if you talk about Khanty-Mansiysk regions, 30,000 rivers and many settlements that are just cut off from the mainland and the infrastructure, then the AI will move to these people, will actually work on the rafts going through the rivers. You can do the research, you can do the testing, and after it's verified with the doctor, the patient will be sent to a nearest medical organization for a full checkup. Have you heard the term multimodality when we talk about the data? In the context of AI, we're talking about the system that can process the information from various sources, like text and images and video. But if we talk in simple terms, multimodal approach helps models to understand the context deeper, as we do as people when we get the information from different channels, our eyes, our ears, nose, and the feelings. The diagnostic research, the medical record, and all of that is analyzed by AI. Now we have autumn. It's the season of flu and cold, and if you have cough and other symptoms, the doctor can give you the request for the computer scan. One of the risks might be related with the coronary calcium increase. The AI can analyze that, and it can put it in your medical record and put a red flag around it. There is a risk of a heart attack. If you don't implement any measures, if you don't do anything, then you need to work on that. It used to be the case that you needed to have special equipment for that. Healthcare is now based data-driven and transparent with AI. And the information about your family members is consolidated and helps to dynamically monitor your health state, to forecast the development of the diseases, and move into a preventive healthcare when you have planned visits to the doctors. I hope that the information today was good, was instructive, and I hope that you will have AI-driven assistants that will be trustworthy and will help you take care of yourself. Thank you very much.